Please go ahead, sir. We are live.
Good morning, ladies and gentlemen. Thank you very much for joining us this morning. It is my proud privilege to introduce such an eminent panelist for this webinar. I'm happy to share today Dr. Padma Shri Professor Mahipal Singh Sachdev, Chairman and Managing Director, Center for Sight, President, All India Ophthalmological Society, Padma Shri Dr. R.V. Ramani, Founder and Managing Trustee, Shankar Eye Foundation, India, and Member Board of Governor of Medical Council of India, New Delhi. Dr. G.V. Divakar, Managing Director, Divakar Specialty Hospital and Asian Research and Training Institute for Skill Transfer. Dr. Saurabh Chaudhary, Chief Executive Officer, Eye Care Eye Hospital and PG Institute and Head of the Department, Cataract and Refractive Service. And Dr. Y.L. Rajesh, who is going to be the person moderating this session for the benefit of all the participants who have gathered here. Before I hand over this to Dr. Rajesh, I'd like to say a few words that COVID-19 has been an historic incident that has taken place in our lifetime. If you look back in the history, we have never seen this kind of incident for more than 100 years. Our generation and even our parents' generation have not seen something like this. It has brought the global economies to their knees. It has challenged the healthcare workers like no time before. And I am so happy to share that healthcare workers, whether in India or abroad, have come forward without any benefit in return for the real cause that has challenged our societies. And my salute to all the healthcare fraternity, and especially those who are giving their own personal time for the benefit of all of us. So I would like to thank all of you once again for coming and sharing with us. Before I hand over, I want to mention a few things which have come to my mind. That during this time, there are two things that we need to look at. Impact of COVID-19 on the eyes and increased incidence of eye strain as a result of protracted time spent in front of computer, laptop, tablets, and so on and so forth, because never before people have sat and did virtual work the way it is being done today. The whole life has changed for the people because they are working from home, and it is only digital platforms that are available for people to operate. Along with this, mouth and nose and the eyes can be the route of transmission of COVID-19 virus. This virus gets passed on primarily through the droplets from cough or sneeze, which can get into our system through these openings in our body. So therefore, eyes have to be protected even from this COVID-19 perspective, because this could be a root cause for the problem. So, eminent panelists will throw more lights on this. It is extremely important that we avoid touching the mucous membranes in our mouth, nose, and eyes, as any contamination on the surface of any object can easily pass on the virus through this mode. It has also been suggested that wearing glasses by those who have normal eyesight provides a shield for eyes by protecting them any droplets that can enter through the eyes. Based on the data so far available, doctors believe that 1 to 3% of the people with COVID-19 will get conjunctivitis, which happens when the virus infects a tissue called conjunctive, which covers the white part of our eyes or the inside of our eyelid. In fact, at the outset of this, the University of Alberta found conjunctivitis is a secondary symptom of about 10 to 15% of COVID cases. Both adults and children have shown a significant increase in digital eye strain. The result is headache, blurry vision, and dry eye as people do not uh, bind enough, causing very level of irritation. School and college students especially are spending long hours in front of their computers, as all form of education are through the online platform. They need to be advised on how they can take better care of their eyes and reduce strain related to complications. We have the best of the best minds available on this webinar, and I'm sure they will give us a lot of tips on this. I'm looking forward to an engaging and enlightening session, and I will now like to thank everybody once again and wish this webinar a great success. And now over to Dr. Rajesh Vyal to take care of the session going further. Thank you very much.
Thank you, Anilji. First of all, I would like to thank ASSOCHAM for conceiving such a nice program, and at this hour where more and more eye care awareness is required because of the special challenges that COVID has posed on us and the eye health care of the country. This is a nice webinar that has come in. I am extremely lucky to have very talented, very reputed panelists. So as a moderator, my job becomes that much easier. Let me have the pleasure of introducing a little more about my panelists. It's my honor and privilege. Padma Shri Dr. R.V. Ramani. He is son of late A. Ramanathan, and he's a proud alumni of Kasturba Medical College, Manipal. He, along with his better half, Dr. Radha Ramani, they envisioned doing great service for the society way back in 1970s, and they founded a trust by name Shankara Eye Foundation. He's the founder and managing trustee of Shankara Eye Foundation, which has touched the lives of nearly 1 crore Indians. 1 crore Indians. They have examined more than 55 lakh rural Indian population, more than 21 lakh free eye surgeries, free cataract surgeries, free eye cataract surgeries, more than 21 lakh. And the list is endless. It's, if you see, it's more of service, service, service. Dr. Ramani strongly believes life is a journey on this planet, and service is the rent that we pay. And he has truly lived by what he believes. He has been bestowed with a lot of awards. He was the Lifetime Achievement Award by Kasturba Medical College, Role Model Award, and Best Humanity Heroes of Humanity Award, and to top it all, Padma Shri Award from the Government of India. Professor Dr. Ramani, welcome you, sir. And now I have our dynamic President of All India Ophthalmic Society, Dr. Mahipal Singh Sachdev. It's my proud privilege to welcome him on this board. He's the most busiest person. I thank him for spending his time here. He's the chairman and medical director of Center for Sight. Is the largest and fastest growing chain of hospitals in the country with national and international repute. He is a professor of ophthalmology. He has been a talented student right from his early childhood with NCERT scholarships, then an admission to All India Institute of Medical Sciences, then post-graduation from All India Institute of Medical Sciences, then a prestigious faculty position in All India Institute of Medical Sciences. But sky is not the limit for his dreams. He left All India Institute of Medical Sciences to start a chain of hospitals where he can nurture the talent of a lot many ophthalmologists and reach out their talent to the millions of Indians. He started Center for Sight chain of hospitals, and he has been extremely successful in that. He has been bestowed with a lot of awards, again Padma Shri from Government of India. So welcome Professor Mahipal Singh Sachdev sir. He is also my teacher. So it's my proud privilege to have you on board, sir. Dr. Saurabh Chaudhary is a dynamic surgeon. Just we pulled him out from the operation theater now. He is the CEO of eye care institutions in Delhi. He is a pioneer in various techniques of cataract surgery. He has demonstrated his surgical skills at both national and international level, and his organization has been doing human service to humanity. Professor Divakar, he is an ophthalmologist, but he is an artist. He is the managing director of Divakar Specialty Hospitals. He is a multi-talented person, looks very sober, but he is there in most of the activities where societal cause is concerned. His organization, Asian Research and Training Institute for Skill Transfer, did relentless work in training thousands of people during COVID time across the India, and motivating and encouraging people from security guard to the doctor in adapting to the new COVID situation and how they can serve. It's a great service which has been recognized by Rajiv Gandhi University of Health Sciences in Bangalore. He is the current president of Bangalore Ophthalmic Society. Anil Rajputji, all of you know, he's the chairperson of ASSOCHAM. He's an economist with a strong focus on various sectors coming up in India and people coming together for larger good. It's very nice of ASSOCHAM to conceive this program of illness to wellness. And in this episode, we will be covering about eye care health. At the end of this session, I am sure all of you will go with a lot of tips about how to take care of your eyes, what message to be spread in the society so that the eye care is preserved and the benefits of it is attained by one and all. With this brief introduction, let me start off the session. In this session, we'll go from panelist to panelist asking questions. You also can pose your questions, and we will be taking up those questions also to answer. We have around 1.5 hours time. In that 40-45 minutes, we'll have a panel discussion, and later on we'll go for question and answer session. First of all, let me open this with structure of the eye. Let me myself, being an ophthalmologist, give you a brief introduction about the structure and function of the eye. The eyes can be compared to a camera. That's a very simplistic way of putting it. The images that we see get focused on inner retina. Retina is the inner structure which is comparable to the film of a camera, and the front surface as the lens of the camera. And we have two cameras. So both the cameras see the same target. The images are formed, and the image in the form of a signal is transferred to the brain through optic nerve. At the brain, it receives two images. Both the images are superimposed, and then they are perceived as one image. The whole thing happens in fractions of seconds. If you have a camera, if I ask you to focus on some target, you will take time, but the eyes can do it in seconds. But if you see near, if you see far off, there is a system inside the eye called the lens of the eye, which has a power called as accommodation, which can move and refocus and readjust so that the image you are seeing becomes very sharp, and these images are superimposed and we see a beautiful image. So, and to focus on the image, we have 6 muscles. The eyes move from side to side. Both the eyes move in such a coordination that the image of one eye and the image of the other eye, they are the same. Even slightest difference in that can cause a lot of difficulties, but all of these actions happen even without our knowledge and in milliseconds time. If you have compared it with camera, it's an insult to the eye, because best of the cameras are only 1/100th or 1/1,000,000th of the eye, the function that the eye can see. I can see more range of colors than anything else. I can do the work much faster than any best camera that we have seen. At the same time, it's a very delicate structure. To protect the eye, it has been housed in a bony structure called orbit, where all around there is a bony structure, and in the front we have a transparent round structure called as cornea. It's a transparent one, and to protect that we have eyelids, and on the top of the cornea there is a thin 7-micron layer of tear film. Thin 7-micron layer tear film, which is very essential. During the course of our discussion we'll get to know more about it. And the eyes have a blink rate to protect as well as to spread this tear film uniformly, so that we get clear and good image as well as protect the health of the eye. And it's our duty to take care of this beautiful structure. Eyes are windows to the soul, people say. Nowadays, with COVID coming in, nearly 40 to 50% of the face is covered, and only the eyes are visible. You need to communicate the whole world through the eyes only. And let us spend some time in this session understanding more about the eyes. So let me start my opening question to Dr. Saurabh to tell us briefly about the common eye diseases that we see among the people. The disease part, common eye diseases, starting from young age to the old age. What are the common eye diseases?
Right. So as Dr. Rajasekhar put it, it's like a camera, and it's got basic two parts. The front part is the lens, and at the back the retina compared to the film. Anything which is leading to any problem in the eye, in this optical pathway, can lead to a decrease in vision. The most common cause of decrease in the vision is a refractive error. What is a refractive error? It is just a prescription of glasses. It is very sad to know that in our country there is a big population of the children who are actually blind because they don't have the access to getting a correct power for their spectacles. They don't even know that they need spectacles, and once spectacles are provided, they will be able to see a lot better. So as I said, the most common cause of decrease in the vision in the child age group is refractive errors. Besides that, malnutrition in our country plays a big role in children. There are a lot of vitamin deficiencies which can cause decrease in the vision, and just that a good education, a good nutrition to these children will help. When I do talk about the education about these things, it is also important that we see a lot of children because of injuries, and they just so in our country, especially in North India, we see a lot of children in gully danda and hitting their eyes. Especially and others in South India have their own particular, so they don't take care of their eyes, children, and once there is an injury, they self-medicate, which leads to permanent blindness. Besides that, in the elderly age group, cataract is one of the leading causes of blindness. Cataract is a reversible condition in which a small surgery will revert it, in which the lens, which Rajasekhar said, gets cloudy because of age. Retina can also get affected by age, including macular degeneration, age-related macular degeneration, which now has some hope in the form of some injections which can be given into the eyes. The dry eye is also a common cause of a problem in the eye right now, because more and more people, as rightly said, are now sitting in front of computers. They're actually not taking care of their eyes in front of the computers. Basically, our eyes are not meant to be doing all this near work in front of the screens. So we also have to take some precautions while doing that. Glaucoma is another condition which can cause permanent irreversible damage to the vision. The problem with the glaucoma is that once it comes in, the patients do not realize, and once it is too late, only then they realize it, and as it's irreversible, it cannot be cured. So it is essential that anybody above the age of 40 should get their eyes cleaned on a routine basis. Diabetic retinopathy and hypertensive retinopathy are the other causes. All diabetics and hypertensives, especially after the age of 40, should go for a regular checkup. Besides that, red eyes is a very common sort of a thing, which includes conjunctivitis, as well as uveitis and other conditions of the eye. Most important bit about it is that it should never be self-treated or treated with the help of a chemist. So most of the patients who land up in problems are the ones who self-medicate, land up in chemists who give them different medications which might not be correct for those conditions. So this is just a brief outlay of all the ailments which can happen to these patients. Yeah, Dr. Rajshekar, we can take it.
Yeah, thank you, Dr. Saurabh. You have brought out very important points. The refractive errors where people wear glasses, a lot of people have that, dry eye, cataract, age-related macular degenerations, glaucoma, diabetic retinopathy, hypertensive retinopathy, so many things. So I'm sure we'll go more in detail about all these things during the course of the discussion. So now, what is the present level of awareness with regard to eye care? Can I ask Dr. Ramani, because you have extensive experience across the society where, whether it's village, towns or cities, and so what's the level of awareness, sir? Are people aware of the importance of eye care?
Thank you, Dr. Rajshekar. Let me, before I start, I would like to, for the audience, introduce Dr. Rajshekar. Modesty prevented him. He's the moderator for the session. And Dr. Rajshekar is from Bangalore. And he's the managing director of Shekhar Netralaya, one of the successful ophthalmic institutions in Bangalore. And he's moderating our interactions this morning. So thank you, Dr. Rajshekar. Regarding the awareness, in fact, Dr. Mahipal, with such an extensive network, also will be able to substantiate it. The awareness is definitely picked up. What was there about 20 to 30 years back when we all started, especially in rural India, we had to go convince them, tell them that it's a safe procedure, tell them that they are in safe hands, and also tell them that it's curable. Half the time they didn't know that some of the diseases are curable. They said, once I have cataract, it is perhaps God's wish, and I'll continue to be blind. So it's a curable condition. So awareness has to be instilled in a big way in rural setup. Though the urban people did have more awareness, I cannot say that they were much aware of the sense they were not aware of some of the specific conditions. Now we talk about glaucoma, we talk about diabetic retinopathy. These are the things which people used to take for granted. They never felt that my uncle had glaucoma, somebody in the relatives had glaucoma. So it could be a congenital hereditary thing, and I need to take it forward and I need to have a checkup. So that was absent over there. Now slowly they are getting aware of that. And similarly, the diabetic. India is going to become the diabetic capital of the world. And one of the first complication would be the diabetic retinopathy. And how many diabetics are aware that they should have an annual checkup with an ophthalmologist and see that they prevent the blindness due to diabetic retinopathy. So these things, by constant awareness programs like this, which create mass awareness, is very, very important for people to know that most of the conditions, if checked early and treated appropriately, they can prevent blindness.
Thank you, sir. Now my next question would be to Dr. Mahipal Singh Sachdev. Sir, you are the president of All India Ophthalmic Society. How do you rate the Indian ophthalmic fraternity or Indian ophthalmology compared to developed countries or elsewhere in the world?
Thank you very much, Dr. Rajshekar. I am indeed a very happy teacher for you because you're doing great work, and keep up the good work that you are doing. Dr. Divakar and Dr. Ramani and Saurabh, and obviously the head of the CSR for ASSOCHAM. Regarding ophthalmology, I think in India, ophthalmology has made rapid strides over the last couple of decades. I still remember at the time when we became residents in ophthalmology, and that was way back in '82, the surgeries were rather limited, and we used to do an intracapsular cataract extraction wherein the people needed to wear thick soda glass kind of glasses, that's a +10 number, and the surgeries were done in makeshift camps. But from there on, I think there has been a rapid progress, whether it be in cataract surgery, whether it be in vitreoretina, whether it be in glaucoma procedures, whether it be in refractive surgery. There was really no refractive surgery at that particular time, and refractive surgery today is the one of the largest performed surgeries. And also there are non-communicable eye diseases which are increasing. Actually, majority of the diseases that we deal with are non-communicable eye diseases, the communicable being conjunctivitis, etc., that Saurabh talked about. But apart from that, with lifestyle change, you are getting more and more people getting diabetic retinopathy, age-related macular degeneration, wet forms of age-related macular degeneration, where anti-VEGF injections, etc., have come. Now, we are proud to say that Indian ophthalmology has kept pace, and rather, I would say at times outpaced ophthalmology across the world. There has been adoption of technologies in India much earlier than even in US because they have a slightly more cumbersome procedure of FDA approval, etc. For example, if you can think of procedures like SMILE that got approved in India, we have been using it for more than a decade, but in the US it's only 3-4 years old. If you look at corneal cross-linking, that came in later. So there are lots and lots of things which are coming in India, and the younger lot of ophthalmologists are actually taking things to the next level. Whatever we had to contribute, we have done our best. But I think Indian ophthalmology today stands shoulder to shoulder to any other country, and the most important thing is that we work with several constraints of finances. So I would say that supposing we had the finances of a developed country and the skill set and the doctors and the service mentality of the doctors and ophthalmologists of India, that would actually play wonders. Nowhere in the world have so many affordable or free cataract surgeries been done for the masses of India or anywhere else in the world. If you look at the number of cataract surgeries, India does more cataracts than US, Europe, and China put together. So that is no achievement. And we have AIOS is the largest society across the world of ophthalmologists of life members. So mind you, Indian ophthalmology has really made rapid strides. We are providing the same technological expertise, better skill sets, and at a fraction of the cost of what is being done overseas. A cataract surgery here can be done, like for example, an Ayushman Bharat would give you 4,000 or 5,000 rupees, which is about $70 or $75. You won't be able to even buy an intraocular lens at that price in the US. So the work that is being done by the Indian ophthalmologist, and now believe me, there is so much of reverse brain drain that there are so many people from overseas who are coming to actually get trained in India for adopting these skill sets, that it is no mean achievement for Indian ophthalmology. So I am really proud and blessed to be part of this All India Ophthalmological Society and the community of ophthalmologists who are actually doing yeoman service. If you look at various other specialties, you don't have cardiac stenting camps, or you don't have knee replacement camps, or you don't have camps for free maybe birthing or whatever it is. So it's only in ophthalmology where people like Dr. Ramani and Arvind Eye Care System, etc., they are doing great service. Chitrakoot, for example, where patients are taken care of at even for Saurabh Institute. People are being taken care of, and we also have the NDCFS Foundation. So I think service is of paramount importance that all ophthalmologists are doing with the best. And mind you, the type of delivery of eye care is same across the board. That means that it is not different for a patient who can afford less or who can afford more, and there could be a cross subsidization that could be there. So Indian ophthalmology is really progressed very significantly over the last couple of decades, and I'm very happy that the next generation is taking it forward.
Thank you, Dr. Mahipal. It's a very wonderful thing to know that. You very clearly said Indian ophthalmology is at par and in certain areas ahead of our Western counterparts. Many of our colleagues and institutions are case studies for universities like Harvard. In the recent webinars that we saw during COVID times, we had the opportunity to listen to various speakers from across the world. One thing was very clear: in the panel, Indian ophthalmologists were shining, and many of the Westerners were quoting Indian studies to showcase how ophthalmology has progressed and many learning points from the Indian ophthalmology. It's very heartening to know that, and I am sure Anil Rajputsi will be very happy to know that Indian ophthalmology is one of the feathers in the cap of Indian industries, because a lot of medical tourism also happens here, and we bring in a lot of attention and a good amount of Atmanirbharata and Make in India happens in Indian ophthalmology. A lot of our products are also made in India and they are exported to many countries. I'm happy to note that. Now coming to this,
I just want to make one point. The awareness level in the community, Anilji, is something that we need to kind of increase regarding eye health. That is something very, very important. The other day I was listening to somebody, and at a very pertinent point that was made was that if you look at the penetration, because there is a lot of money involved there, and because there are a lot of big corporates that are involved, the penetration of a mobile phone is over 1 billion of them. That means that almost everybody across the country owns a mobile phone. But as Saurabh said, more than about 25 to 30% of the people of the country require glasses, just plain simple glasses, need an eye checkup and need to wear glasses. But I think only about 50% of them are wearing glasses. So this is a big disconnect only because of the awareness. That is the problem. Today, the spectacles and the optical manufacturing hub is China. I think we should bring it to India. And along with that, the awareness should go that a child at the time of birth, at the time of say 1 year and before going to school, and then every year at school needs an eye exam and should necessarily wear glasses if required. Because if you need glasses for correction of your refractive error, and you do not wear them, your performance in school and everywhere goes down, in college goes down, and that is something very, very important that needs to be told. The awareness has to be increased. And mind you, it is only in India that the largest cause of blindness today is cataract, which is a totally reversible disease. That means that if a person is given surgical treatment and the cataract is removed, then the person will get back the normal vision. That is not the case in developed countries. So we have to have the awareness of people coming in for eye examinations and going in for surgical interventions as and when required from the surgeons who are available in India with great skill and efficiency that they have. So I think the industry has to come together with the societies like All India Ophthalmological Society, state societies, and with the ophthalmologists, like even diabetic retinopathy, as was said, that is increasing significantly. And if untreated, that would become the leading cause of blindness maybe a decade from now. So these are the things where eye care awareness has to go to the people. The industry has to participate in it. Maybe there isn't enough money in it, but I think as a corporate social responsibility, we need to take this forward so that the patients do not needlessly remain blind.
so very, very good points, very valid points, and earnest appeal to all the viewers is that you need to visit an ophthalmologist not when an eye problem is there. Many of the eye conditions are silent, as Dr. Mahipal Singh Sachdevji was telling. The glaucoma blindness is there, even the cataract. These things do not cause symptoms. And spectacle refractive error. When I asked Saurabh Chaudhary common eye problems, first thing he told was refractive error. So many people require glasses. Glasses do not cost much, but when they wear those glasses, the vision with that is so much better that their overall performance, including their efficiency at work, will improve. So the awareness part is actually less. It is becoming better than before, but it is not up to the mark. So there's a lot of scope for illness to wellness. So we need to start visiting the eye specialist periodically. Having said that, let me ask Dr. Divakar. So what's the impact of this online practices? The current day, a lot of school children are on laptops, screen time is increasing because of online classes and all that. And during COVID time, many people are homebound. What's the impact of these online practices on the overall health in children or in adults?
Thank you, Shekhar, for asking this important question. Please, I thank ASSOCHAM for organizing this important seminar on illness to wellness on eye healthcare and online practices. Because once in March, when the lockdown started, most of the schools were closed and colleges are closed, and all the teachers has to take classes from home. So these online classes has been has increased by about 74 use of online devices like laptops, iPhones, iPods has increased number of about 75% more when compared to the previous to this COVID pandemic. So once the children, I am in the panel for suggesting to government of Karnataka regarding what are the guidelines for the children to conduct online classes or how to conduct this, go ahead about this. So it is headed by NIMAS director, Dr. Gangadhar was the chief of that. So we did a study that online classes are quite good, but normal screen time is about maximum 20 to 25 minutes. And above that, it causes more eye strain. So for children, we should advise the teachers to take classes for about 20 or 25 minutes, then give a gap for about 15 minutes, then one more 20 minutes or 25 minutes they can take. And one more recommendation was that up to 1 to 3rd class, no need of advising any online classes. Only parents has to be given some online teaching like that. They told in the panel it was suggested like that. So parents can teach the children because up to 3rd standard there is no use of this online will be quite difficult for the children to concentrate like that. So after 4th standard it's quite good, and in the college students also we can take. I, as a faculty of DNB faculty in Shankar Eye Hospital, where Dr. Ramani is the chief of that, I am taking online classes for DNB students. It's quite good, and they are quite attentive, and we can quite interact like regular classes. But most of this online teaching leads to some complications, like when you are seeing on the screen, the blinking rate will reduce, and it causes burning in the eyes, some dry eye symptoms like that. To avoid that, we should reduce the screen time and reduce illumination on the screen, and we use some refresh tears and other supplements like that. So, and online teaching, along with that, they may get, since they're using laptop or the computer for a long time, they can get the symptoms of computer vision syndrome, like concentrating for a long time, they can get eye strain, headache, and other. If normally these are COVID pandemic times, they're afraid to go to hospital to get the eyes checked, because last week one parent called me, sir, are you available on Sunday evenings for consultation? I asked him why. Sir, I'm afraid to come to hospital because there are so many COVID patients will be there. So I want evening when nobody is there, I want to come on for the eye checkup. He was asking me like that. So like that, the fear psychosis has to be removed. That we should tell that in the hospital we are using all the safety precautions, and you can come and have your eyes checked up like that. So with the full correction of the glasses has to be done, and after that, if they observe any of these symptoms, we can advise them the medications or some other outreach programs, exercises like that we can ask them to do. So these are regarding the most common with computer vision and computer related problems we get. Thank you.
Thank you, Dr. Divakar. Thank you, Dr. Divakar, for highlighting all the importance of this computer vision syndrome and how to prevent that. Because COVID is going to be there for a little longer time, initially the thinking was to restrict the online classes and not to have online classes for younger children. But later on, government has realized that since we have to live with this COVID for some more time, they have relaxed those rules. But This is where ophthalmologist role and programs like this come into effect. Online classes have been started for even preschool children as young as 3 to 4 years are sitting in front of the systems. It has become a new way of reaching out to them, teaching them. That's under the given circumstances has become one of the alternatives, and hence following all the eye care precautions can give you the benefit of these online classes, at the same time taking out the disadvantages of this computer vision syndrome. What are the few tips, Dr. Saurabh, you would like to give those who spend a lot of time in front of the computers? The tips that they can remember, if you can summarize in 1 or 2 minutes.
Right. So computer vision syndrome is a new sort of entity which has formed, and especially it was coined way back in 2007 when more and more people started sitting in front of computers. There are a few components or a few symptoms which a person has when they sit in front of computers. It includes, actually in layman terms, let's call it an ocular strain, because a set of muscles is working more than what it is supposed to. Irritation in the eyes. Some people also experience redness. Some others might find focusing disabilities, doubling of vision. All clusters are forms under the computer vision syndrome. There are 3 major mechanisms which cause vision syndrome to occur. One is the extraocular, that means which is outside the eye, the muscles which are taken in the eye. One is the accommodative, the internal muscles which have to focus differently than what our body is used to. So those are the accommodative or the internal muscles, as well as the surface disorders, that is the inner film. Because so there are a few things which have been seen, and the visual effects basically is because we are working on screens which have a different brightness, different quality of vision, resolutions are different, and that's why when we are not looking, our body, our eyes are not used to it. As more and more of us, and especially during the COVID time, are moving onto screens, these things are up on the rise. How do you take care of these? As rightly said, there is something which has now been coined as 2020 rule. For computer professionals, we do tell them to take a break every 20 minutes for about 20 seconds, get somewhere 20 feet away, just to relax the muscles, and then start working back again. In fact, I know of some of the companies in the West. Whenever the user logs onto the computer, every 20 minutes the screen goes blank. It prompts the user to get up, walk 10 steps, and walk back 10 steps. Let's start working again. So this prompts better blood circulation, the muscles, the neck, the back, the wrists, eyes. Definitely, that's what we started off with. So everything is taken care by doing the 2020 rule, and it is very important. As Dr. Diwakar said, that computer users blink a lot less frequently than what a regular person does. And each time we blink, it works like a wet screen wiper. So a person has to blink a lot frequently and has to make an effort to blink a lot more. Besides that, we also tell our patients to do some exercises. Since the person said that the muscles, there's a muscle component, right? They do need to do some push-up and balance exercises where they need to look at it, get it closer, so that the image doesn't break into two. This takes care of the accommodative or the internal muscles. But besides that, there are a lot of other things which we could to prevent computer vision syndrome, including lighting in the room, the positioning of the body, the positioning of the computer screen. All these things have to be done into to prevent computer vision syndrome.
Thank you, Dr. Saurabh. And now my next question is to Dr. Mahipal. Before that, I would like to ask Mahipal, sir, would you recommend any specific classes for these people who are using computers? Because that's one of the questions that has come from viewers. Do you recommend any classes?
Yeah, so Dr. Rajshekhar, just carrying on from where Dr. Saurabh left and the question that you have asked, one of the things which has been proved beyond doubt is that the eyes are made for distance vision, and if a person is using them excessively for near work, there is an increase in the incidence of myopia. Apart from that, means the need for wearing minus glasses. Apart from genetic factors and environmental factors, I think this is one of the most important things. And there is a progression by about 1%, 0.5 to 1% increase in myopia almost every year. And in countries like Japan or the Far East, the incidence of myopia goes as high as 60 to 70%. That means that 60 to 70% of the people who are there, they need minus glasses. And that is the trend that we are seeing in India also. And there are certain studies which are going on with good results, wherein to avoid this accommodative strain, there is a strain of accommodation which Saurabh was explaining. And to avoid this accommodative strain, which causes an increase in the myopia, we are now using very low drops concentration of atropine eye drops to have a effect of a person not being able to accommodate that much and therefore not causing an increase in the myopia. So long-term studies are going on. Singapore SNEC is doing a major study on this, on long-term effects of using low dose of atropine. Now the question that has come, the idea in all these is to reduce the accommodative spasm or the accommodative stress that is there. And there are a lot of companies, and there is scientific evidence to show that blue cut glasses, these are glasses which block out the radiation, the UV radiation, etc., and they tend to relax the eyes. So these are some of the glasses, but it is not 100% evidence there, but there are some studies which have said, and the lot of optical chains are promoting this very significantly. You can have screens in front of the computer which can reduce the intensity of the light should not be that, it should always be adjusted. The position of the screen should be adjusted, and as said, 2022. And also what is very important is that when you are working on the computer, your blink is inadequate. So the tear resurfacing does not happen. So one should necessarily open, close the eyes, or use off-the-counter lubricating eye drops. So these are a couple of the things which are there. And the specific thing is that yes, we also at times recommend blue cut, but the evidence is not 100% conclusive that the blue cut lenses which are blocking these rays can reduce the strain. But there is absolutely no harm in wearing that or putting a screen in front of the computer which can reduce these rays that are coming into your eye.
Thank you, sir. Thank you. Just to summarize for the benefit of the viewers, these online practices have become a new norm, right from younger children to the older people, whether it's education or the work itself, it's happening in front of the screens. To protect your eyes, you need to follow that 20-20-20 principle, wherein you give enough rest to the eye in between your work sessions, and the lighting and the ambient lighting in the room, keep it in such a way that there is less impact of contrast related damage to the eyes. The blink rate is very important because you have to keep the surface of the eye moist. And there is one school of thought saying wearing glasses which cut off blue rays is beneficial, but that's still not a very proved one. Those who have to use glasses, they can go for anti-reflection coating on the surface of the glasses anyway if they are using for refractive errors. Yes, definitely, if you have refractive error, you need to have periodic checkups to have it properly corrected so that there is less strain on your eyes. With these few practices, you can carry on your screen time with due precautions and at the same time maintain the health of the eyes. It's an important question. A lot of people have asked questions with regard to this. Through these answers from Dr. Saurabh and Dr. Mahipal, we could answer many of the questions that have come in. Now, going on to this COVID-related thing, again, sir, Dr. Mahipal, sir, I'm coming back to you. COVID-19, it's a viral illness. How has it affected ophthalmic practice? Where is it that as a disease it can show up in the eye, or how ophthalmologists should take precautions so that this disease doesn't spread in eye care institutions? After this, I'll again ask the same question to Dr. Ramani. So first to Dr. Mahipal.
Well, Dr. Rajshekhar, the ophthalmologist, ENT, dentist, etc., these are few of the specialties where the people or the medical personnel have to come very near to the nose and to the mouth of an individual. So the eyes, as you know, it's all in the face, and it has also been shown that there is the viral load which can be there in the tears of an individual. And majority of the examinations that we as ophthalmologists do, we do like on a slit lamp, or you're doing an ophthalmoscopy, etc. The contact, the distance between an individual is very, very little, and it's very difficult to maintain the 2 yards distance or the 3 yards distance that is necessary. So there is a possibility, and if you look at the number of healthcare workers who across the world who have been infected, there are a lot of ophthalmologists who have got infected. So therefore, it is very, very important that both the patient as also the ophthalmologist need to take precautions. So we have put up barrier screens. The All India Ophthalmological Society came up with the guidelines. The first thing is that before a patient is entering into the hospital or into the eye care center, the temperature is taken, a history is taken, and then only with normal social distancing the patient is brought in. And then for each and every specialty and each and every examination, there are barriers that we have tried to put in for the ophthalmologist and the optometrist, the use of cleansing solutions, surface disinfection, hypochlorite, etc. So all those things, use of UV light, etc. When there are no patients in the environment, that is something which has been suggested. One important thing that I wish to kind of bring out for the patients is that unfortunately the case fatality rate is higher in patients who are 60 or 65 and above. And ophthalmology, we do deal with a lot of geriatric patients, so there is a normal fear psychosis which is there. But one very, very important thing is that eye care centers do not have COVID patients admitted in them. They are primarily care centers. There are some when just now the camp surgeries are normally restricted, but so there the patients do stay indoors. But majority of the eye clinic centers do not have indoor patients. So the contact time, if at all there is any, for the patient is going to be very, very minimal and not with any significant viral load. So I think the single specialty eye care centers are the safest for the patients to come, rather than maybe go to a multi-specialty hospital where you would have patients with COVID, because it's a short stay. For example, a cataract surgery would take about 10, 15, 20 minutes at an average, and the patient would be out having got it done under topical anesthesia or at best with a peribulbar block. So patient is out of the system very, very fast. So that is something that I have to say. The other important thing is that all due precautions are being taken by the ophthalmologists. The All India Ophthalmological Society brought out a book which you were also involved, which is over 103, 104 pages, wherein we have listed the precautions and the standard operating procedures for treating patients, asymptomatic patients, etc., who are coming in for a normal ophthalmic care. One thing which is very, very important is that a patient can irreversibly lose one sight if you do not come in for treatment and intervention at the proper time. The number of patients with mature and hypermature cataracts that I have been operating over the last couple of weeks are far more as a percentage than I was operating in the pre-COVID time, because people have neglected coming in for getting a surgery done, and they are waiting and waiting, and the cataract is going into mature cataract. They are coming with lens-induced glaucomas, even NVI, etc. Diabetic retinopathies have missed or ARMD have missed their anti-VEGF injections. Glaucoma patients have not come in to put the drop. So what is very, very important is that we need to tell people that COVID is not going to go anywhere over the next couple of months. I would say that it's going to be part of the life. So what is very, very important is to take the precautions, and with precautions, do not ignore your visit to the ophthalmologist. Though we have come out with tele-ophthalmology, at times home visits have also been started, and that is very, very important, that the person should contact maybe on tele-ophthalmology, and from tele-ophthalmology, if a visit is required, then a person should come and get the visit done. All the precautions are in place, and I think the ophthalmic community has responded very, very well to this COVID crisis. And touch wood, as far as my knowledge goes, there has not been any cases that have been reported of infection from eye hospitals to the patient or vice versa. So patient safety has been on top of the mind of all the ophthalmologists and AIOS, and I urge the patients to, with taking proper precautions, safety precautions, to come for their scheduled eye examination and not disregard the fact that they can go on to irreversible blindness if they neglect coming to an ophthalmologist.
Thank you, sir. You have brought out very important points, and you made powerful statement saying eye hospitals are one of the safest places amidst all these things because of the so many precautions that have been taken in eye care hospitals. And you also made a very powerful statement saying many people have delayed taking care of their eyes during this period due to so-called fear psychosis, and they are ending up either as a complicated cases, or some of them might have even lost vision. In fact, under Dr. Mahipal Singh Sachdev, the All India Ophthalmic Society spent more than 2,000 man-hours of specialist time in chalking out various strategies that could be adapted inside the hospital so that it could become safe place for eye care to continue in spite of the pandemic that's going on. It's a 100+ page standard operating protocols that have been devised. In fact, that was the first document to come out internationally. Many people, American Society of Ophthalmologists, they brought out much later, and that version looks almost like half of what we brought out. It's a great detail. All India Ophthalmic Society brought out under the chairmanship of Dr. Mahipal Singh Sachdev. That has helped us. That is the basis on which he is very emphatically saying, to my knowledge, there is no incidence of any COVID happening inside the eye hospitals in the country. That's because so much of precautions have been taken. Thank you very much, sir, for that. Now over to Dr. Ramani, because they brought out a book which said when unlocking was starting, they're back to work, kind of a good document they brought out, which we have all used. Dr. Ramani, sir, how have you made eye hospitals a safe place for eye care to continue so that we can prevent blindness? We can take out the fear of people coming to the hospitals. They don't have to go blind because of that. Dr. Ramani, please.
Yeah, Dr. Ashekar, I would like to first reiterate whatever both of you, Dr. Mahipal Singh, as well as yourself mentioned about the safety aspects as far as the ophthalmic facilities are concerned. So the general public should be aware that a lot of preemptive steps have been taken at the eye hospital level, eye clinic level. Perhaps it is a very safe place. So right from in our practice, there are two important things. One are the patients on one side and our own team of doctors and paramedics on the other. We need to take care of both of them. As far as the patients are concerned, we are following very strict measures, right from the safe distancing, checking them at the entrance, giving them a provision to wash themselves and then walk in, wash their hands and then walk in, and then the temperature recording. And somebody briefly just interacts to know whether the patient has got some fever or some symptoms. These are things which are done before the patient enters the hospital per se. And once the patient enters the hospital also, we are following the norms. Wherever a waiting hall would have around 100 seats, now only 50 patients are accommodated. Attenders are not allowed just like that. Unless the patient is pretty old and is visually terribly handicapped, we don't allow the attenders inside. They can wait outside comfortably. So not to crowd. The concept is, the bottom line is, don't crowd the hospital at any given point of time. Then we have a triage area where again we check all those patients' eye infections, so they don't have to go through all the things. And at every point, whether when we do the glass checkup or subsequently in the optical shop or in the doctor's consultation chamber, we have ensured that all these principles are followed. What we have done at Shankar Eye Hospitals, we extended the working hours. We said, let us work, instead of working for 8 hours, let us work for 12 hours. So that the patients can be spread over these 12 hours, and brought a shift system for the employees. So they work, instead of 8 hours, they work only 6 hours intensively. Then the other batch comes back. So what happens? The patients are comfortable. Same number of patients can be seen or even more. At the same time, we are also trying to encourage people coming by appointments. And now the telemedicine, it's a big boon. Patients can always consult the hospital. try and take some advice. It has been legitimized. It has been made a law that telemedicine is accepted all over. And I do not know how many of them are aware that even insurance takes care of telemedicine. Now, so telemedicine consultation prior, not for everything. Once the doctor feels, oh, you have to come to the hospital, the patient can move over. And this kind of precautions have been taken. And as Dr. Mahipal said, eye surgical patients also not waiting more than a couple of hours. So you have a place where everything is done, place is comfortable, doctors and paramedical staff are aware of every single point, and it is perhaps the safest place to walk in. So do not delay. Do not delay. Do not delay. Whether it is just for a glass correction or whether it is for your routine glaucoma checkup, or you're a diabetic, you want to have an annual checkup, or a cataract, you don't want to go into a hypermature stage, please do not postpone with that fear psychosis in your mind. Now, in our setup, while we have taken all precautions for the patients and assuring them, we also felt we need to take care of the paramedical staff, the doctors, and who are the live wires, and they're the people, the frontline warriors. So what we did, basically all of them, what do they have? They have a fear of infection. They are worried whether they'll be carrying it to the family. Sometimes they are frustrated about the uncertainty. Some have even a fear of losing a job. So all these things were there in the beginning of this pandemic, in March and April. So we said, this is something like a psychological first aid. Whenever there is a disaster, we know there is a psychological first aid. So we said, let us also try and do that. And we had a 5-pronged approach to that. The first one, we said, it is spark. We told everybody, we said, create a sense of safety. First, they should feel I am safe. Then my patients are safe. So we said, first, social distancing in spark, the PPEs, the strict PPE control, the protective equipment, what you need to wear, adhere to all guidelines, set guidelines meticulously, first regulate yourself, and also isolate in case if you have symptoms. And last but not the least, keeping the hands clean all the time. So this kind of a spark thing which was given to everybody. And then we said, let us make them feel calm and comfortable. What did we do? There are a couple of medical people, service providers might have small children at home, or just a baby who's just being groomed, then they would like to take. We said, okay, take a couple of months away. So we gave them the benefit of sabbatical and asset, and that really boosted, and they came back with energy and said, okay, we are now fine, we would like to work here. Now, the third one, what we did is create a self and collective efficacy. All of them together as a team. We created a team which just looks at every single point. It is not that we give the protocol and leave it. This is followed up meticulously every month, every week to see whether it is being put into place. And then communication. Communication builds bridges, even within our own team, constantly interacting with them and telling them what all steps have been taken, the insurance, what's provided to the people, the COVID coverage policy for every single employee, so they know they're taken care of. And last but not the least, create hope in the mind. So constant messages from the higher ups, actually that boosts the energy. So what happened on one hand, you have a highly charged, encouraged, confident set of people who are willing to work, the ophthalmologists, the paramedical staff, the support staff, and administrators. On the other hand, we have patients. Patients who now feel, okay, I am comfortable. I go to the institution, ophthalmic hospital. I am perfectly safe, and I will also take care of my eye condition at the right time, not postpone it. So this is how the ophthalmic fraternity, and I should, all of us took the tips from the All India Ophthalmic Society's beautiful. Thanks, Dr. Mahipal, it was a great thing. And from then on, to suit our own individual requirements, each institution made our own this. Now, post-COVID, just a word, all the children have been exposed a lot. There are any number of undetected visual defects in children. We have an extensive pediatric program. Couple of decades back, the undetected visual defects in children used to be around 5%. Believe me, pre-COVID, just last year, we measured it as 15%. 15% of school-going children have undetected visual defects, which the child did not know, the parents did not know, nor the teachers. Now, after COVID, it's going to be more, maybe even 20%. So children need an eye checkup. As he suggested, at the time of birth, before going to the school, and then on regularly, eye checkup is a must for children, as well as those executives who are sitting in front of the computers for a pretty long time. So the message is to all the people from ASSOCHAM, vision is the gift of God, to behold the beauty of nature. Whatever may be the cause, to be blind is not fair if it can be prevented or cured by quality eye care.
Thank you, Dr. Ramani. Thank you, Dr. Mahipal, for bringing in this a brief summary of measures that have been taken by eye care institutions across the country to make it a safe place, COVID-free places, so that the eye care can continue. And though this was not part of the discussion, it's our happiness to tell all our viewers that though you walk into an eye hospital as if you were walking in before, a lot of hard work, lot of thinking, lot of innovations, lot of modifications in the processes, and a care and concern has gone into the thinking of how the eye hospitals are working during this COVID period, so that your continuity of eye care happens, and the fear of COVID should go away. The staff have been motivated that way, the processes have been redefined that way, and the treatments are being done. And in our experience also, we have been successfully treated all these people, both the medical treatments as well as surgical treatments, without even a single patient having to get the infection of COVID by taking all these precautions. The basis of all this is, in the beginning part of the lockdown, we saw some people reaching out to us saying some blurring of vision is happening, this is happening, that's happening. Some people not even reaching out to us because of the fear of COVID. Later on, when they started walking into the hospital, we saw many of them have lost the crucial time period during which much better things could have been done. They had lost some part of vision, because some of the eye diseases are silent. They will not cause you pain. There is no redness in the eye, nothing. Slowly the disease will be happening inside the eye, and one may lose eyesight if periodic examination is not done and treatment is not done on time. One such thing is diabetic retinopathy. Can I ask Dr. Saurabh to tell few words about what are the precautions that a diabetic patient should take? COVID or no COVID, his eye care should continue. He has to protect his eyes. How is it that a diabetic patient, if they neglect, can lose the eyesight? Then we will come to glaucoma, then we will come to age-related macular degenerations.
Right. So diabetic retinopathy is a condition which happens in naturally diabetics, and the most important is the period by which the patient is suffering from diabetes. So usually, a patient who has diabetes of 10 years or more is more susceptible to be having diabetic retinopathy. The other factor is the control of diabetes, and it is essential that all diabetics should be controlled. So what we need to understand is that diabetes affects three main organs of the body: the kidneys, the nerves, and the retina at the back of the eye. And we, as laymen, we must have heard of a lot of diabetics on dialysis, a lot of diabetics having feet which are very numb, and then leading to amputations. Similarly, a lot of patients do land up with conditions in which there are small bleeding spots on the retina. Once these spots swell up, the patient does not realize that anything is happening. It is the ophthalmologist, the eye specialist, when they look into the eye, they can see that the initial changes are happening. If it is caught at that stage, some precautionary measurements can be taken and the disease will not progress. But if the patient lands up with a decrease in the vision and he lands up at a hospital or a clinic, the ophthalmologist or the eye doctor can only do that much just to prevent the vision from deteriorating further. So it is very essential that all diabetics, in spite of the fact that they're controlled or uncontrolled, should visit an ophthalmologist twice a year, get a retinal dilatation done, and the retina checked. Besides that, if there are changes, early changes, it can be taken care with the help of lasers, or now predominantly with the help of other injections which are easily available now. They were a lot more expensive a couple of years back, but the costs have come down pretty much, and very soon they are all going to be included in the insurance packages. So it is essential, it is corrected at that time, but just in case these patients are in later stages, vitreoretinal surgeons, the largest statement, can actually take care of these do a simple surgery, which was a lot complicated earlier, having better results now, and manage these conditions. But the underlying fact is control of diabetes and a regular examination 6 monthly with a dilatation and checkup of the retina to make sure that the conditions are controlled well in time. One major thing that the patient would not know that there are changes happening inside the eye, and it has to be picked up by ophthalmologists, so they need to go regularly in spite of the fact that they're not having any problems.
Thank you, Dr. Saurabh. So very well brought out points. All diabetics should remember that it's a potentially blinding condition. In spite of sugars being under control, the eye problem can be inside the eye in a silent form. It will be revealed only through an eye examination, that to a retinal eye examination. And everybody should remember that if these changes are detected early, then eye can be protected. If there is a delay, in spite of the best of the treatments, vision may not be restored. So, and hence the key is having periodic eye checkups. So Dr. Saurabh was saying at least twice a year, And if some people have already diabetic retinopathy in various stages, then as per the advice of the doctor. Since it doesn't cause pain, it's a silent illness, this tends to get neglected. And hence it's important that people continue to have periodic eye checkups. Now, my question is to Dr. Mahipal Singh Sachdev. What is the impact of delaying cataract surgery? So during COVID time, many people have delayed cataract surgery for the fear of coming to the hospital. So can one who has to get operated now, can he get operated 6 months later or 1 year later with equally good results? What's your takes or what's your tips on that?
Okay, so a good question, Dr. Rajshekhar. Cataract surgery is normally surgery which is considered an elective surgery. But if the cataract becomes over mature, that means that cataract is trending. Nowadays, the concept has totally changed. Earlier, the concept was that one needs to wait till the cataract to be mature. This was say 30 years ago or somewhere around that. But now the concept is because we have to break the cataract into small little pieces and take it out. So the cataract, if it is immature, it is much easier for us to work with that cataract. Now, if the cataract over time becomes more mature or it becomes more ripe, so it can lead on to complications. The size of the lens tends to increase because the volume increases and the chamber, the front part of the eye gets crowded. So there is fluid that is constantly being manufactured in the eye, which is called as the aqueous. So the outflow of the aqueous gets compromised and the patient can go into an attack of glaucoma, जिसको हम काला मोतिया कहते हैं. Cataract is सफेद मोतिया and glaucoma is kala motia. So you can get into an attack of glaucoma or kala motia where the pressure suddenly shoots up. And if this pressure remains high, there is irreversible damage to the optic nerve and the optic nerve goes into an atrophy. So this is therefore requiring an emergency intervention. So we should never take it to a stage where a person would need an emergency intervention. The simple test that a person can do is you can have a clock or something or a painting on the wall, close one eye, close the other eye, and look at the details of that, the arms of the clock. And if there is a significant difference between the two eyes, often one eye compensates for the other eye and a person does not realize that there is a diminution of vision and the cataract has gone on or going on into a state of maturity. So that is a simple test that you should do. If you have a cataract, close one eye, close the other eye and look at the clarity of the vision that is there. Please do not delay till such time that the vision is dropping very significantly. As I told you, you can have problems of angle closure glaucoma. There can be uveitis. There can be even neovascular glaucoma that can happen. The other important thing is that if you have a hypermature cataract, it causes a lot of problems to the surgeon to manage that, and the incidence or the complication rate goes higher, and then fitting an intraocular lens becomes more difficult. So it is therefore mandatory, I would say, for a person to not wait till such time that the cataract is maturing, even though it is an elective surgery, but you should not delay it so that the chances of a good outcome do not reduce. So that is the take home message, that if you have a cataract, please go get it checked up or check it at home as to how bad your vision is. And if your vision has gone down substantially, cataract surgery should be done very well. Often a person, it has been conclusively shown that if a person has a cataract even in one eye, the chances of having accidents while driving, because a person does not see, if you have a cataract in one eye and you are not able to see from the side from that particular thing, the chances and the reaction time of a person to brake or to do anything or to take a turn, etc., goes down. So that is very, very important, that you should not put your eye or your life at risk by just merely postponing a cataract surgery.
Thank you, sir. So cataract surgery, generally people were looking for an auspicious date and time and were getting operated. And because of COVID, many people have neglected the care and they have postponed. The impact of postponement is not good. People can end up losing the eyes. They can have other associated damages because of the poor vision, falls at home or accidents on the way, and so on and so forth. And since hospitals have taken so much of precautions, one doesn't have to have the fear. They can get treated as earlier. And another thing that we have noticed is many people think their vision is reducing because of cataract. But another thing that can happen is, in addition to cataract, there can be an illness inside the eye, the retinal illness called macular degeneration or retinopathies, which are again silent, which will add to the vision loss. So person is thinking that, oh, vision is reducing and I'll get it done maybe next month, few months later. But it could be due to an associated illness also. Unless an examination is done, this is not, it's not possible to make out why and what. And hence, do not fear because of COVID visiting your ophthalmologist, because there is a risk of losing eyesight for various reasons, various conditions that are silent inside the eye. So now, so Dr. Divakar, can you tell us the benefits of training that you people have achieved through ARTIST, wherein you could motivate so many people to visit eyes, and you are also associated with slightly deviated one with apart from ophthalmology, even in gynecology things, so many deliveries could be done during this COVID time. What's the role of training and benefits of training that have come up?
It's a good training program we did the digital training program for all the so many smaller hospitals in Karnataka and all over India. And in that we used to practically tell them what are the hand washing techniques and how to sanitize hands, how to maintain the safe distance, and how to do online consultations. And before coming to the hospital, normally we used to give them a Google form where they fill up whether they've got any pre-symptomatic or predisposing factors, or they're suffering from diseases like fever, cough, or breathlessness, or anything. They would fill up that. Or have they visited any of the areas with containment zones? All those things they would fill up before coming to the hospital. And after coming to the hospital, normally we used to do the non-touch technique of payment, like online payment or through Google Pay or Phone Pay, like that payment charges. And in the hospital, we have to protect the staff also and all the patients also. We used to take a special consent form from the patients. It's a COVID consent form. Even for treating the outpatients also and for inpatient procedures also, we take a separate consent form with all the precautions that I am responsible if I carry the infection to any of the hospital staff, and I am not, I won't hold the hospital responsible if I get the infection after visiting the hospital like that. Because in the hospital, we normally maintain all the safe precautions we take, and all the sodium hypochlorite solution to clean the surfaces, everything. All these trainings are given, and so the special consent form is one important thing we have to do. And all these things we used to train them. And normally the nursing staff and about waste management also, even the PPE kits, what they use, they have to immediately dispose them. What are the methods of disposing, how to the donning and doping of the PPE kits, and all those things with the videos we used to teach them. about 5,000 nurses has been trained, about 500 doctors has been trained through these training programs through
Thank you, Dr.
online. Thank you.
So many people in Karnataka and across the country have got trained under artist program. This was very useful initially when people didn't know how to cope up with COVID-19 related practices within the hospitals. It came as a big boon that time. We have a lot of questions that is coming in. We are having last 10 minutes time. Next 5 minutes, Saurabh, can you take a rapid fire questions? I'll ask the question within 10-15 seconds. You can answer that so that we'll have the participant thing. One of the participants is asking about a floater in the eye. So a floater in the eye, what is the cause? Should they visit an eye doctor?
So a floater in the eye could be very innocuous. A floater in the eye is just a vision. In your vision, you see something floating around. There is a jelly inside the eye, which is behind the lens in front of the retina. Sometimes it liquefies, and it could be because of that. But if floaters are associated with any flashes of light, then you need to visit an ophthalmologist or eye specialist definitely. But if there is a floater, it is good to get your eyes checked as well.
So don't neglect the floater. If it is there, if it has come for the first time, you must visit an eye doctor. If it is associated with the flash of a light, then you must visit a doctor. It can lead to a condition called as retinal detachment. Don't neglect the floater. Thank you, sir. And another one person, Ashish Patia, is asking, what is the role of protective glasses while watching TV and computers? Dr. Mahipal Singh has answered, but Saurabh, quickly you can answer that question.
There are a lot of companies which are coming up with blue filtering lights and blue filters. So I would say that it still hasn't been proven totally beyond doubt. But yes, there is it's a fast upcoming field and new things are coming. But yes, there are filters, and it's according to some of the doctors do promote them, the others don't. Personally, I do not. But yes, it is an interesting field which is coming up very fast.
There's one question. It's a curiosity of a person. I'll read out the question as it is. Some research suggests after using 4 to 5 hours of digital device, there is increase in temperature of the eye. We are not sure about that. And on the other hand, we give hot compresses in dry eye syndrome. And my question is, will hot compress affect the eye badly, Dr. Saurabh? I think the first statement itself doesn't have, Saurabh.
This statement is, I think that there's no proof, or I don't know where it has come from, as rightly you said, Dr. Rajshekar. The second statement is that, yes, the dry eyes have different components. There are different types of dry eyes. One of the dry eyes, as diagnosed by an eye specialist, if it has meibomitis, that means that the glands are not secreting too well, then a hot compression has a big role in it. And it's one of the major mainstays of treatment of meibomitis or where the oily secretions are. So it is not that simply that you have a dry eye and you need to do hot water fermentation. But if you have a dry eye with meibomitis as the underlying cause, then hot water fermentation is a must. There are a lot of newer studies, including viewing the meibomian glands, these glands which are not secreting very well, with infrared cameras, and then treating the patients with modulated heat treatments. So there are various treatment modalities. The Mahipal says that India is right up there in the forefront in the various technologies. So we all have now these technologies, and patients will benefit from them as well.
Thank you, Dr. Saurabh. There are many questions, but most of them have been answered during our discussions. Now, before we wind up, I'll ask a very sensitive and tricky question to Dr. Mahipal Singh. Sir, many people advertise about free eye checkups, free testings, will come home and give you glasses, especially some of the optical chains and all that. Some of them, like, what is the difference between an examination that's under free eye test by an optometrist and a complete examination by an ophthalmologist? So many public think they are same, and चश्मे का जांच है तो पूरा आंख का जांच हो गया करके. So what's your take on? Sir, you are not audible, sir. Yeah.
I was muted, sorry. I don't think it's a tricky question at that. I think it's a very valid question. Unfortunately, optometry, which you know also, which it is part of ophthalmology. So the sync between the two is kind of getting a little dashed. So if you're looking at about 23,000 ophthalmologists or 25,000 ophthalmologists in India, the number of optometrists is also about the same. And there are lakhs and lakhs of optical shops which are there in the country. So essentially what is happening is that there aren't trained enough optometrists who are there in all the shops which are optical shops, and where the numbers are being prescribed by people who are not trained for that job. Obviously the paramedical, the optometry is an associated branch of ophthalmology, and we as ophthalmologists during our exams were supposed to do the or did the refractions etc. for the patients. And that is a part and parcel of that. We more often than not, because of the large number of optical shops, patients typically go to an optical shop first. And if at all that optical shop person is not able to improve the vision or whatever it is, normally they will just prescribe a glass. They will otherwise then only the patient will come to an ophthalmologist. The problem is that you need a complete ophthalmic checkup, and an optical dispensing is an art. It is a science which also involves a person to do a complete ophthalmic checkup. Often if you just do a pressure at that particular point, as you were talking about glaucoma etc., and the pressure is high, then the patient needs a more detailed checkup. If a person is having cataract, the first thing that a person having a cataract or a glaucoma or an ARMD would just say that I am having diminution of vision. So that cannot be neglected or ignored, because if the disease is caught in proper time, irreversible damage can be taken care of. So these are just people who may or may not be trained at all. They are not optometrists even who are going for home care. So that has to be taken care of. And I think if we have to build an omni-channel, the one of the important things that Dr. Ramani also pointed out is that now tele-ophthalmology or telemedicine is legal. And there is a lot of things that have been done over the last ever since COVID came and earlier to get devices. One of the important things in ophthalmology is that by far you can visualize all the different structures of the eye if you have a proper imaging device. So having low cost imaging devices, where even if you do a home care with a person who may not be an ophthalmologist, the images can be sent to an ophthalmologist and the ophthalmologist can see it and then dispense. So I think a backbone of an ophthalmic care is something that has been neglected by ophthalmologists in the optical firmament. It is very important to have this thing told to the patient that untrained somebody, a vision assistant or anybody cannot diagnose what an ophthalmologist can diagnose. So it is mandatory that even if you are getting glasses, there should at least be a preliminary or a routine eye checkup that should be done. A detailed eye checkup can be done elsewhere, but this thing, so the symbiosis and the working together with the optometrist and ophthalmologist needs to increase. The optometrists are very to refer patients to ophthalmologists, and that is what is happening, and that needs to be broken somewhere. I think during the COVID times, even the instructions for the optical shops we did together with the AIOS and the optical, and we think we need to strengthen that, and we need to have awareness of the people that an optometrist, not an optometrist, a person running an optical shop may not be trained enough to actually even dispense a proper number of the glass. A wrong number of the glass can also have deleterious effects on say headache, lack of focusing, etc., etc. So that is also something which is very important.
Thank you, sir. So many people get confused between these two. So an ophthalmologist is one who has done his MBBS, 5.5 years of MBBS, and then 2 or 3 years of post-graduation, MD or DOMS, and years of practice. He is basically a doctor who knows the complete health of the body as well as specialized in health of the eye care. Whereas an optometrist can be just is not a doctor, he is a trained technician. They have a limited role. An examination by an optometrist cannot be equal to examination by an ophthalmologist. Sometimes a good spectacle number prescription also, he might have missed diseases like macular degeneration, glaucoma, or cataract, or many blinding diseases. So people should know the difference, because it comes under the heading free eye testing and this thing. So they get carried away. When we are talking of illness to wellness, people may be caring for their eyes, but if they are caring under wrong banners, it may lead to problems. So we are coming close.
Dr. Rajshekhar, I would again want to make a difference that majority of the optical shops do not even have optometrists. See, I do not, optometrists are going to be an important leg in the delivery of eye care. I don't disregard their work, they are an important leg. But even not having a trained optometrist and dispensing glasses is something which is wrong.
Which is wrong both legally as well as for the health of the patients. Anilji, see, after having said all these things, an eye care, the people going for preventive eye care is an investment in their eyes. What do you say about that, sir? Because otherwise the trend is only when they have a problem they go, and sometimes when they have a problem and they do not know, still they don't go.
Thank you very much for asking this question to me. See, in life, people have to recognize and realize that if you are not paying for something, if you are not paying for a product or service, then you are a product yourself. Somebody is making a trial and error on you. So it is very important that you go to a professional, seek professional help in any field in life. If you make a mistake, sometimes it could be an irreparable mistake. So this should be a general message to every person that you should always seek professional help. So since we are coming close, I would like to thank all the panelists. I think they have given a very, very good message to all our participants. We had over 350 to 400 participants attending this, and I'm sure they have all gained from the wealth of experience that you have shared with them. Dr. Saurabh Chaudhary made very pertinent point, saying that you need to make regular checkups. If you don't do regular checkups, don't go for self-medication, because that is not going to help you in the long run. Do exercises. At the end of the day, it is a very important organ of your body. So best is to take good care of it. Dr. Ramani made another important point when he said that level of awareness has grown. Telemedication has taken place over the years, but is it enough? We need to actually be careful. Children today, this undented vision effects increased in children from 5% to 15%. Okay, so therefore there is a need to kind of continuously from the early age get your eyes tested. Vision is the beauty of God. Those were his golden words, and I'm sure all the participants have learned and picked up from it. Dr. Maipal made many important interventions, and he said that ophthalmologist has made a great stride in this country. There was time when surgeries were done in this country in a makeshift camps, and today our people are making news at the global level. So it's a matter of pride for every Indian, and we ourselves, Indian community, has to make full use of it. If we don't make use of it, all this knowledge that we have gained will be not really worth anything. So I suggest people to take note of all the advices given to people. Wearing glasses should not be a taboo. In India, maybe wearing glasses is a taboo, and therefore there is a need to create more awareness amongst the people that it is all right to wear glasses. There is nothing wrong, and maybe corporates can play a role in creating awareness in this field. Dr. Divakar also made many pertinent interventions where he talked about that, eyes have strain if you are continuously working. So therefore, after every 20-25 minutes, we need to give a bit of rest so that there is a reduced screen time for the people. Near vision increases myopia, Dr. Mahipal said, and screen in front of computer can be useful and be a great help to the people. People don't blink enough when you are sitting in front of a television or TV screen or in front of a laptop or a computer. So therefore, there is a need to kind of work on it. Dr. Rajshekhar also, while Rajshekhar also made a very important comment by saying that you should have a principle of 20-20-20. The principle of 20-20-20 can help you. People neglect eye care during COVID time, so it may not be important. It may not be very, very wise that you delay or postpone your decision if you have to go ahead and get any of your important eye care intervention done. I actually received one question from somebody who is postponing his cataract operation. So maybe after I say, somebody can quickly advise him whether he should immediately get that attended, because there may be many people who will be making the similar kind of mistake by postponing, even though he is taking all kinds of medicine for this. But I'm not too sure whether it is right for them to postpone this kind of thing. Dr. Chaudhary talked about for diabetic patients, because India is a diabetic capital of the world, that they should get their eyes tested twice a year, if not more, if they have over 10 years of diabetes. So these are very, very important messaging that has come around, and people who have attended this, they would have taken the message with them, and I'm sure they will take proper care going forward. As wise people have said, a stitch in time saves 9. And I think all of you have brought this home to the audience, and I thank you very much for this. Anybody can answer that person's question on cataract.
I think we answered that question specifically as regards cataract surgery. It should not be postponed because it can, and there are no medicines, you said, despite putting drops and all, there are no medicines that can cure cataract. And there is absolutely no evidence that any of these homeopathic medicines or any other medicines can reduce the speed at which cataract is growing. So surgery is the only answer, and by delaying the surgery, the chances of having a complicated cataract surgery becomes higher. The visual outcomes can become worse, as also you can go into the complications of lens-induced glaucoma. That means the cataract can get spoiled and become a glaucomatous. This thing, you can have inflammation in the eye, etc. So that's what I said. Even when you are at home, keep looking at a watch with closing one eye and going on to the other eye to see if your vision is going down. And if the vision is going down, if the blur is increasing, you should definitely come forward and get your cataract surgery. Otherwise, you can cause problems to your visual recovery.
Thank you very much. Dr. Ramani wants to say that.
Now, this year, 2020, for obvious reasons, all of us would not like to remember this year. But at least from the point of view of what Dr. Rajshekhar said, those who are facing the computer, this 2020 formula, let that be the takeaway message for the year.
Great.
So during this COVID time, in addition to COVID, many people have had the wrath of neglecting non-COVID diseases. So we saw a lot of patients getting into eye-related problems because of the neglect. So that should not happen. The eye hospitals across the country are well geared up to give you a safe environment and to give you the best of the cares. Nobody should lose vision because of the fear of going to an eye specialist, and nobody should lose vision because of the lack of awareness of eye illnesses. That is the spirit behind which all the stalwarts here spend their precious time. They're all busy people. I'm extremely thankful. It's my privilege to have been moderating this session, and my thanks to ASSOCHAM and Anilji and his entire team for putting up this program. I thank the participants for having stayed with us and participated. So many questions they have sent. So with this, I give the stage back to Anilji for giving his concluding
Thank you
remarks.
very much, everybody, once again. And special thanks to Dr. Rajshekhar for conducting this, this seminar very well, raising all the pertinent questions, keeping the entire session very engaging, and I'm sure participants would have benefited manifold from this session. Many thanks. Thank you very much to all of you. Thanks a lot.
Thank you, sir. Thank you all. Thank you. Thank you.